So we're back. Obviously, I am Dr. Val Jones, founder of GetBetterHealth.com, and here we are at HIMSS interviewing some of the most interesting vendors and exhibitors here, and they're here to tell us a little bit about different things. And, we just dropped a tough book, and now we're going to talk to Art Papier, who is a physician, and he's with Logical Images, and he's going to tell us a little bit about Visual DX and all the ways that physicians can access that. So, Art, thank you so much for being here. Tell us a little bit, just to lay the ground rules here. Let's just talk about what your company does.
Well, thanks, Val. Well, the need we see in the marketplace is to have better tools for diagnosis. Cognitive mistakes and physicians not knowing, who aren't experts, happen all the time in every office. And so what we do is we bring better information right to the point of care as your clinician's making a decision. And being a dermatologist, we focused on visual presentation. So we started about 10 years ago with a desktop application called Visual DX. And what's exciting at HIMSS this year, we're announcing for the first time Visual DX, the name of the product, on the mobile device. So all 18,000 images that are on the desktop and all the differential diagnoses that you can develop on the desktop, all available on the iPhone, which is really pretty cool because, for instance, emergency physicians who are busy, they're on the move, they can't get to a desktop often, they can then grab out of their pocket the iPhone and develop a differential diagnosis.
Wow. So tell me a little bit about, the version 1 and what it was built to do exactly.
Well, the very first component 10 years ago covered the differential diagnosis of the patient with fever and a rash. And we picked that because a patient with fever and a rash can have a life-threatening illness. And we wanted to bring the expertise of a visual expert to the emergency room. And so we launched that 10 years ago. And since then, we've added in 29 other components. So we handle pediatrics, we handle adult medicine, we handle travel medicine. We also have a component on drug-induced disease. So, so many patients are on multiple medications, and there's always this concern, is the medicine causing the disease? So you look at your standard resources, it says the word rash. Well, that isn't very helpful. You're a busy doc, and you want to know what type of rash, what type of diseases can be induced by the medications. Right. So it's a real patient safety, patient quality issue here, where we have so many patients on so many medications, and the clinician does not have the information to make the decision, is this medicine causing this problem? So it's one area that we think is really important for us to get the news out. There is a product now, and not only on the desktop, but it can be in your pocket. So I can go on my iPhone app, and hopefully I'll be able to show this on the web, is say build a differential diagnosis.
Yep, just put that up by the
okay, and so let me
by
just
the camera when you're ready.
Click it first, and you'll see how quick this is. I can just type in the common medicine, naproxen, that's used for arthritis. And so I'm typing naproxen, I choose naproxen, I hit done, and then what it does, it builds a visual differential.
Yep, there you go.
Of naproxen, and then I want to see, well, what's fixed drug eruption? So it's going to find me this disease called fixed drug eruption. You see the images at the top, and then it says see all 52 images. So rather than just showing the classic example of disease, what we can do is we can bring to that decision maker, and you can make these full screen, a typical iPhone way, and you can even swipe your finger and get another image.
Wow.
And then you can zoom by spreading your fingers. So what we have in the pocket of the physician now is a tool that covers 1,000 diagnoses, 18,000 images, but it's really unique because you can search by patient symptoms and signs. So there'll be a lot of discussion at this meeting about meaningful use of electronic record and clinical decision support. The term clinical decision support has become very broad. We're in the space of diagnostic decision support. And there's only a few people doing this, and we're really the first group to say that pattern recognition is critical to making diagnoses at the point of care. And so it's not just dermatology. Patients who have infections, people who have nutritional disease, metabolic disease, present with visual patterns, what's the skin or mucosa or the eyes. And if we can bring this knowledge to the generalists, they can make better decisions.
That's really exciting.
Yeah.
So what if a patient comes with a rash that, they don't have a fever or any real constitutional symptoms? And how would, just walk me through what a general a general practitioner would do?
You'd go back to right to the home page here, and it says build a differential. And so it says, well, tell me about your patient, adult or pediatric. So if we said they're pediatric and they're neonate or infant, I could choose to put in findings for the neonate or infant. Or if it was for the adult, I'd go this direction, adult. If they had dark skin, we'd say choose dark skin. So one of the features that we're working on and strategies that we have is not just to show the classic example of a disease. Right. So patients present, you learn this as soon as you're out of medical school, not like the textbook. They present as individuals, a lot of variation. And so in terms of pattern recognition, it could be mild or severe, early or late, or the patient could have dark skin, and the textbooks are biased.
It's excoriated beyond recognition.
Right, all kinds of changes. And rather than just showing one classic example, what we strive to do is show many, many different examples of the same disease so that you as a clinician or human being can just use your innate pattern recognition ability to say, that really looks like my patient. I better investigate that.
That's really exciting. It's really interesting. What level of detail does this prompt for description of the lesion?
Well, so, some medical students and residents and, young physicians might need help with, well, what's the terminology? Because obviously you're only as good as your knowledge of how to describe what you see. And so, there's terms like vesicle and bulla and eschar that every med student's expected to learn. Well, we realize that often they don't learn them. So what we do is we've created these icons that represent the skin morphology types that help the user with the word. So you can go in and see a picture of the eschar and search by eschar, and then you'll have all the eschar diseases. So it's really a visual paradigm to medicine, thinking about pattern recognition. So we do eye and oral. We have chest radiographs in there. So rather than having all these separate atlases in healthcare, we're trying to aggregate them into one system.
So it's far more than dermatologic presentations of disease. It's